Surgeon mocked a patient praying to the Virgin Mary before surgery. What happened during that operation shocked everyone. A miracle of the Virgin Mary that began with arrogance and ended in a way no one expected. But before we continue, leave a comment telling me where you're watching from and what time it is there right now. I'd love to see how far the miracles of the Virgin Mary are reaching. You know that doctor everyone respects but no one wants to talk to? The one who's brilliant but cold as ice? Dr. Richard Matthews was exactly that kind. 52 years old. Cardiovascular surgeon for 28 years. One of the best in the state. Hands that never trembled. An impeccable reputation. And a coldness that made residents cry in the bathroom after rounds. When Dr. Matthews entered the operating room, you could feel the tension in the air. It wasn't admiration, it was fear. Fear of making a mistake, of disappointing him, of being the target of that look that made you question every decision you'd ever made. Medicine is science, he repeated like a mantra. There's no room for magical thinking here. You know that kind of person who has an answer for everything, who never ever admits not knowing something, who built an entire life upon absolute certainties. That was Richard. His office at the hospital looked like a laboratory, no photos, no plants. Nothing that indicated a human being worked there. Only diplomas on the wall and medical charts arranged with military precision. The other doctors respected him. But no one had lunch with him. No one invited him for happy hour. Because Richard Matthews had no life outside the hospital, and he didn't want one. Work was his religion. Until that October Tuesday, Frank Morrison was 65, with the look of someone who had lived well. Gray hair, big carpenter's hands. A gentle smile, even though he was about to undergo a complicated heart surgery. Mr. Morrison, Nurse Sarah checked his blood pressure for the 4th time. How can you stay so calm? My pressure would go up just thinking about it. Frank gave that peaceful smile and pointed to the blue rosary beside him on the bed. I've already placed everything in her hands. There's no point in being nervous now. The rosary was old, blue glass beads worn with age, a silver crucifix whose details had almost faded over time, clearly something that had passed through many hands, many prayers, many years. It was my mother's, Frank explained. She prayed with it every day for 50 years. When she passed away, she left it to me. Margaret, Frank's wife of 40 years, sat in the chair beside him. She also held a rosary, smaller, light pink. Her lips moved in constant, silent prayer. Their daughter, Jennifer, appeared with a cup of coffee. 28 years old, eyes red from crying in the hallway. "Everything's going to be fine, sweetheart," Frank said, before she could even ask. Jennifer tried to smile but could barely manage it. You know when you look at someone and realize that person truly believes. It's not an act. It's not for show. It's just who they really are. Frank was like that. His faith was as natural as breathing, and it was exactly that faith that was about to collide head-on with the arrogance of Dr. Richard Matthews. 7:45 a.m. Dr. Matthews entered the pre-op room with his usual expression of impersonal efficiency. Tablet in hand, impeccable lab coat. "Mr. Morrison, I'll explain today's procedure." Frank opened his eyes and smiled. "Good morning, doctor." Matthews began his technical explanation, the same words he had said hundreds of times before. Incision here, estimated time, potential risks, recovery expectations. He spoke automatically, didn't even need to think anymore. Frank listened attentively. When Matthews finished, Frank nodded. "I understand, doctor. Thank you for explaining everything so clearly." Matthews was about to leave when he noticed the rosary on the small table. He couldn't resist. "Mr. Morrison, I see you brought that." He pointed at the rosary with a vague, almost disdainful gesture. "Yes, doctor. It's my mother's rosary. It always gives me peace before important moments." "I see," Matthews said, his voice taking on that tone of superiority he used when he wanted to make it clear he found something ridiculous. But I need you to understand one thing, Mr. Morrison. What will save you today isn't that rosary. It's 28 years of my experience and extremely well-trained hands." The silence that followed was heavy. Margaret stopped breathing. Jennifer's eyes widened. Sarah, the nurse, pretended to be very busy with the monitor. Frank looked at the doctor for a long moment. No anger, no offense. Just that calmness that seemed to irritate Matthews even more. "Dr. Matthews," Frank said softly, "I trust your hands completely. I know you're excellent at what you do. But my faith doesn't take anything away from your skill. It just gives me peace. And I'm going to ask the Virgin Mary to bless your hands today as well." Matthews felt something strange in those words. He ignored it. "Nurse Sarah, patient cleared. We start in 15 minutes. And he left without looking back. If he had looked, he would have seen Frank picking up the rosary and praying quietly. He would have seen Margaret holding her husband's hand. 8:15 in the morning. Frank was taken to Operating Room 3, intense white lights, shining metal instruments, the smell of disinfectant, the constant beeping of monitors, a room like any other where Dr. Matthews had operated 1,000 times. The team was already in position. Dr. Chen, assistant surgeon, 3 nurses, anesthesiologist, perfusion technician, everyone tense, because working with Matthews was always tense. Frank was transferred to the table. The anesthesiologist began to prepare. "Mr. Morrison, I'm going to start the sedation. I need you to count backward from 10. Frank nodded. But before he began, his hand moved quickly, making the sign of the cross on his chest. Quick, discreet. But Matthew saw it, and felt that familiar irritation. 10, 9, 8, 7. Frank's voice grew weaker. His eyes closed. His body relaxed. "Let's begin," Matthews said, his voice professional and sharp. The surgery began at 8:32. The first 45 minutes were perfect. Every incision calculated to the millimeter, every movement economical, precise, efficient. Scalpel. Retractor, suction, the team responded in perfect rhythm. It was a well-rehearsed choreography. Dr. Chen watched in admiration. Even after 3 years working with Matthews, he was still impressed by that mechanical precision. "I'm opening the left coronary artery," Matthews announced. "Prepare the graft." That's when everything fell apart. The monitor started beeping differently, faster, more urgent. "Pressure dropping," someone said. Matthews looked at the surgical field. Fluid was filling the thoracic cavity faster than the suction could clear it. "Where?" Dr. Chen asked, already moving to assist. Matthews searched with his fingers, quick but controlled. His trained hands explored, looking for the source. Tension leaked into his voice for the first time. "It's ruptured. Suction here." The entire room changed. Routine turned to emergency. Confidence turned to tension. "Pressure dropping," the anesthesiologist reported. "I can't see clearly," Matthews said, and there was real frustration in his voice now. Dr. Chen tried to help, but only made things worse. The space was too small. Matthews's hands, those hands that never trembled, that never failed, began to feel the pressure. The vessel was at a difficult angle. Every second counted, and for the first time in years, he felt something he hated to feel: doubt. He rarely lost patience. His success rate was 98%, one of the highest in the state. But now, have you ever been in a situation where everything you've always trusted suddenly isn't enough? Where your skill, your experience, your confidence all seem too small? Dr. Richard Matthews was in that moment, and it was at that exact second that it happened. First came the smell, roses, fresh, impossible. In the middle of a sterile operating room filled with disinfectant, Matthews lifted his head for a fraction of a second, confused, looked around. No one else seemed to notice. The team remained focused, tense, waiting for orders. He turned back to the surgical field, tried to ignore it. It had to be exhaustion, stress, something caused by adrenaline, but the smell grew stronger, more real, more present. And then came the second thing, heat. His hands, inside the surgical gloves, suddenly became warm. Not the heat of sweat, not the heat of tension, it was different. As if someone had placed their own hands over his invisible hands. Hands that weren't there, but were. Matthews froze for half a second. Impossible. Completely impossible. But the sensation was so physical, so real, so undeniable. "Dr. Matthews?" Dr. Chen's voice was tense. "Pressure's dropping. We need to act now." And then it happened. Matthews's hands moved. But it wasn't him who moved them, or maybe it was, but there was something else, something guiding, something directing each motion with a precision beyond training, beyond experience, beyond anything he had ever felt. His fingers found the vessel. In the middle of all that bleeding, in the middle of that visual chaos, they found exactly where the problem was. The suture came out perfect, quick, fluid, as if his hands knew a path his mind didn't. Precise stitches, exact, impossible to perform with that poor visibility. "Pressure rising," the anesthesiologist announced, obvious surprise in his voice. Dr. Chen looked at the surgical field, then at Matthews. "How did you do that? I could barely see the vessel." Matthews didn't answer because he didn't know himself. The scent of roses was still there, fainter but present. The warmth still enveloped his hands. That feeling of not being alone, of being guided, of someone moving his fingers with a skill that wasn't entirely his own. "Continuing," he said, his voice lower than it should have been. The rest of the surgery was technically perfect, but Matthews operated on autopilot. His mind divided between the procedure and that impossible moment he couldn't explain. The warmth remained until the last stitch. The scent of roses disappeared only when they closed Frank's chest. 11:27 a.m. Surgery completed. Total success. Frank stable. Heading to recovery. Excellent prognosis. Doctor. Matthews left the room as he always did. Controlled steps, professional posture, neutral expression. But in the locker room, alone, he collapsed. He sat on the chair and looked at his own hands as if he had never seen them before. They were trembling. Not from exhaustion, from something he couldn't name. He could still feel a trace of that warmth, like a physical memory that refused to leave completely. He stood up, walked to the sink, washed his hands under cold water. Scrubbed them hard, as if he could wash away that sensation. He looked in the mirror, same face as always, same controlled expression. But the eyes... There was something different in the eyes, confusion, fear. No, something worse. Doubt. Doubt about everything he had built in 52 years of life. Doubt about his absolute certainties. Doubt about what had really happened in that room. The scene returned without permission, the scent of roses where there had been no roses. The impossible heat surrounding his hands, the precision beyond training during that critical suture, the physical, undeniable sensation that someone was guiding his movements. "No," he said out loud. "It was adrenaline. It was—" But he couldn't finish. Because for the first time in decades, Dr. Richard Matthews had no explanation for something he had experienced. And that terrified him more than any surgical complication ever could. That night, in his empty apartment, Dr. Matthews couldn't sleep. He sat in the armchair by the window, watching the lights of Philadelphia below. He tried reading medical articles on his tablet, tried reviewing the next day's cases, tried doing anything to occupy his mind. But his thoughts kept returning to that moment in the operating room. What if Frank Morrison had been right? What if those prayers... Dr. Matthews stood up abruptly. "No, I won't. I can't..." But he couldn't finish the sentence. The following weeks were the strangest of Dr. Richard Matthews' career. Frank was recovering exceptionally well, far beyond what was expected for someone his age after such a complicated surgery. "The tests are perfect," Dr. Chen commented as they reviewed the chart. He's got the cardiovascular health of someone 20 years younger. Matthews just nodded, but that unease kept growing in his chest every time he saw Frank's name in the system. The residents whispered in the hallways. "Mr. Morrison is already walking around the corridors," one said in amazement. 3 days after that surgery? Incredible. "I heard there was a serious complication during the procedure," another added. "How did he recover so fast?" Matthews heard them and pretended not to. Sarah, the nurse, noticed something had changed. She had known Matthews for 8 years. She had never seen him so unsettled. "Dr. Matthews, are you okay?" "Yes." "Why do you ask?" "Because you've been avoiding Mr. Morrison's room since the surgery. He asks about you every day." "I'm busy." "He knows you're avoiding him." Matthews didn't answer. He just walked away. Because how could he look at Frank without remembering, without feeling that impossible heat in his hands, without questioning everything he'd always been certain of? But something was changing inside him. He started noticing things he had always ignored. The elderly woman in room 305 who prayed the Rosary. He had always thought it was a waste of time. Now? He'd pause for a second when passing her room. He'd watch the peace on her face as the beads slipped through her fingers. The young father in 412 who held a medal of Our Lady before his daughter's surgery. Matthews used to roll his eyes. Now he noticed how the man's hands stopped trembling when he touched that medal. Now. He noticed the peace on their faces, the genuine calm even in the face of fear. "You're different, Doctor," Chen remarked casually during surgery 2 weeks later. "Less rigid. I can't quite explain it." Matthews didn't reply. But he knew it was true. He was more patient with the residents, less critical of small mistakes. Still demanding, still a perfectionist, but there was a softness that hadn't been there before. 2 months after Frank's surgery, on a Thursday afternoon, Matthews was reviewing exams in his office when Sarah knocked on the door. "Dr. Matthews, emergency surgery, ruptured aneurysm." "Critical patient arrived 15 minutes ago." Matthews stood up immediately. Professional mode switched on automatically. In the operating room, he quickly reviewed the scans. It was a complicated surgery, but well within his capabilities. The patient was brought in. She was conscious, and she was holding something in her hands, a small rosary, black beads. Matthews looked at that rosary. He remembered Frank's blue one. And for the first time in his entire career, he did something completely out of character. "Dr. Rodriguez," he addressed the anesthesiologist, "can you wait a few minutes before sedating?" The entire team stared at him as if he'd grown a second head. Dr. Matthews never ever delayed the start of a surgery. He approached the patient. "Ma'am?" "Patricia," she whispered weakly. "Patricia. I'm Dr. Matthews. I'll be operating on you now. I know you're in pain. But if you'd like to say a prayer first, you can. I'll wait." Patricia's eyes widened, then filled with tears. "Really, doctor? Thank you. Thank you." She closed her eyes. Her trembling hands clutched the black rosary, and Matthews stood there, beside the stretcher, waiting patiently while she prayed softly. The entire team was in silent shock. They looked at each other in disbelief. Who was this man, and what had he done with Dr. Matthews? When Patricia finished, peace covered her face despite the pain. "I'm ready, doctor. Thank you for waiting." "You're welcome. Now, let's take care of this." He gently took the rosary and placed it on a tray beside her. The surgery lasted 4 hours. It was technically flawless. No major complications. A complete success. 6 months later. Dr. Matthews was alone in the locker room after a long surgery. He looked at his own hands under the cold light. He never told anyone. He never will. But every time he sees a patient praying, something inside him, something that had been asleep for decades, wakes up for a second and whispers a question he hates. What if? Dr. Richard Matthews is still a skeptic. He still trusts science. He still needs proof. But now he carries a doubt he can't erase. And maybe, just maybe, that's what had been missing in his life all along. And listen, if you've made it this far, write in the comments "guided hands," because that's exactly what he felt during that surgery, even if he'll never admit it to anyone. I want to see how many hearts this story truly reached. And every time I read "guided hands" in the comments, I'll know that one more person believes the miracles of the Virgin Mary still happen. If this story touched your heart, subscribe to the channel and turn on the notification bell. Write in the comments about a miracle you have witnessed or experienced, and share this video with someone who needs their hope renewed today. May the Virgin Mary continue to bless and protect you and your family. Amen.